So the role of orexin in narcolepsy is, it is really the cause of narcolepsy. Type 1, so the cases that are the most typical that have cataplexy, they don't have any orexin in their cells. The cells that produce orexin have been destroyed, and that's why they have the whole syndrome. This is a very exciting time for narcolepsy because first, the cause of narcolepsy type 1 is a loss of orexin neurons, and there have been a lot of breakthrough in the field. One of them is, of course, the development of new drugs that are targeting the orexin system. There have been antagonists that are used for sleeping pills, but now more excitingly, there's a number of companies who are developing agonists, which will stimulate the receptor. And the preliminary results, actually with one drug from Takeda, TAK-925, have been spectacular, because they completely eliminate pretty much the symptoms of narcolepsy, which is logical because that's the cause of narcolepsy. I mean, I shouldn't say eliminate completely because there are still some issues and we don't understand everything, but it seems to be much more effective than anything else that has been available. For example, there is a test where we kind of keep people awake for 40 minutes, and we try to tell them to stay awake and doing nothing. And a patient with narcolepsy falls asleep in 2 minutes. With the existing drugs, you can raise this to 15 minutes when you're lucky, and 10 minutes. And with this drug, everyone could stay awake 40 minutes, the entirety of the test. That's called a maintenance of wakefulness test. So clearly the drugs are very effective, and it's going to make a big difference for narcolepsy. That being said, of course, it's a beginning, and in fact, one of the the first drug that was developed was an IV drug, and then they developed a drug, Takeda developed a drug that was orally administered, but unfortunately it had a side effect, liver side effect, so I mean, this is public information, it was, the clinical trial was stopped. But there's at least 4 or 5 other companies that are developing, I don't know how many, but many companies are developing agonists, and it's going to make a huge difference for patients with narcolepsy. So yes, I'm very excited.